Physical structure. We will discuss the quality standards for physical structure in a hospital. So, quality standards for prevention and control of infection. First thing, the responsibilities. Who is responsible for preventing and controlling the infection? Obviously, hospital infection control committee and the infection control team. The members of the infection control team and hospital infection control committees are responsible for the policies updation, regular review, and control of the other workers when it comes to prevention and control of infection. Resources. The resources available, yeah, are there proper resources available for infection control and prevention? Does the hospital have hand washing facilities at wherever all the care areas? Do they follow the isolation facility? Do they have HEPA filtration system, etc.? uh, do they have enough resources and resources allocated for um, personal protective equipment, etc.? So that is the resources. The goals of infection control program. So the hospital designs and implements a comprehensive infection control program that identifies the procedures and the processes associated with reducing the risk of infection and prevention of infection. So risk-based approach is followed here. That becomes the goal of infection control program. Medical equipment and devices. You have to make sure that all the medical equipment and devices used in patient care, general patient care or critical patient care, is properly cleaned, disinfected, decontaminated, and sterilized according to the policies and protocols provided by the manufacturer and the hospital's policies, regular policies. Infectious waste. Does the hospital follow biomedical waste management policy, proper segregation at the point of generation, proper safe handling, disposal, and treatment is going on or not? Construction risk. If at all there is a demolition or new construction coming up, does it interfere with the infection control practices of the hospital? Transmission of infection. If it is like antibiotic resistant infection, an outbreak, surveillance system, etc., will come under the transmission of infection. Quality improvement and education program. It depends upon the accreditations also. Will verify if you have enough quality improvement and education program at place, and continuous training of the staff, retraining of the staff as and when required. So that comes under the quality improvement and program education. Medical equipment and devices, you have to make sure, uh, follow the splotting classification, etc., to understand which devices require low level disinfection, which supplies or equipment require high level disinfection, and which will go into which kind of sterilization, chemical, heat, moist heat, hot air, etc. So that classification has to be done. Then storing after cleaning and sterilization. Do not store the sterilized and cleaned and disinfected equipments in a wet area or a moisture ridden area. Okay, so these all things have to be kept in mind. As much possible, try to keep the sterilized equipments in closed cabinets instead of putting it in open shelves. Demolition and construction and renovation. So some risk assessment should be done when a demolition, construction, or renovation is going on within the hospital. So these are the risk assessment which has to be done. The air quality. Sometimes demolition will lead to dust particles, cement particles, etc., being dispersed in the air, which is going to be used by the hospital visitor staff, etc. So air quality assessment should be done. Infection control. Some of the demolition construction procedures may interfere with the general infection control practices of the hospital. For example, it may stop the oxygen supply, it may stop the um, route of biomedical waste transportation, etc. So that risk assessment should be done. Utilities, the basic utilities like toilets, common toilets, which has been used by the visitors, may have to be changed. They may have to start using the inpatient toilets, which may put the inpatient into risk, etc. So those are just examples of utilities. Noise, obviously, when demolition construction is going on, noise will be there, and would that noise and vibration both will hamper the patient's overall general satisfaction, etc. It will put a wedge between a smooth transitioning into health and hazardous materials. If demolition and construction is getting hazardous material into the premises of the hospital, for example, some radioactive materials or any other construction materials which may pose as a hazardous material within the hospital premises. Such risk assessment should be done. Emergency services may have been stalled because of demolition services, which is taking place near the emergency department. If you are renovating the emergency department, etc. Other hazards may affect the care treatment and services. Control of infection by air. The main thing is barrier precaution. Do hand washing, wear gloves, gowns, your PPE. That is the first and foremost step to control infection by air. Next is put the patients having airborne infection in isolation room, and put them ideally in negative pressure isolation room. If all these isolation rooms have HEPA filter, that is well and better. Make sure your ICU high risk areas have HEPA filtration. All the OTs should have HEPA filtration, high efficiency particulate air filtration systems that will take out all the used air from the room. It will filter it out and send back the good air to the central supply of the room. That is how the HEPA filter works. So these are the steps that has to be taken to control the infection transmission by air. Thank you.